If you are hypertensive and you are taking lisinopril, please don't scroll. Wait and watch this video. And if you have any relative, whether father, mother, brother, sister, friend, that is hypertensive and is taking lisinopril, please share this video to them because I want to talk about something that is very important. First, for those meeting me for the first time, I am an emergency medicine physician. I see patients with acute and life-threatening illnesses. All right. So, what is lisinopril? Lisinopril is a medication given to patients with high blood pressure, and it belongs to a family we call the ACE inhibitors. That is angiotensin converting enzyme. Now, how does this medication work? There's a pathway in the human body we call the renin-angiotensin system. Okay, at the point where angiotensin 1 is converted to angiotensin 2, the enzyme that facilitates that process is the ACE enzyme. So that is what we call the angiotensin converting enzymes. Okay, so it converts angiotensin 1 to angiotensin 2. And the function of angiotensin 2 is that it causes vasoconstriction, okay, and sodium and water retention. What lisinopril does is to inhibit that enzyme. Now, when that enzyme is inhibited, there is vasodilatation. That is how it helps to bring down the blood pressure. Lisinopril is very effective. However, it has side effects. This is the purpose of this video. Now, what are the side effects of lisinopril? There are various side effects, but I will be talking about the three most common that I have seen in my practice. I have seen patients come down with this side effect again and again. So the first among the three I will talk about is persistent cough. Now, if you've noticed that since you started taking lisinopril, you have started coughing. And this cough is a dry type of cough, not the one that produces something. Okay, because bradykinin accumulates in the lungs, it stimulates the reflex of cough, so you keep having cough. And this can happen few weeks after starting lisinopril. It can happen many years after starting lisinopril. So when you have persistent cough and you have tried to rule out the causes of cough, but you've discovered everything seems normal, you might be dealing with persistent dry cough from your lisinopril. So it's important you let your doctor know for proper review. The second thing that you might notice is that your potassium will be going up. Now, what happens is that lisinopril, as part of the family of ACE inhibitor, they cause potassium in the body to go up. So it's important that once you start taking lisinopril, please monitor your potassium level. Okay, such that when you start having high potassium, your doctor will be aware and something should be done. This side effect I'm talking about is not just peculiar to lisinopril. It's peculiar to the family of ACE inhibitors. Whether you are taking lisinopril, you are taking enalapril, you are taking ramipril, or the pril, these side effects are associated with them. Third side effect that we'll be talking about, which can be an emergency, is angioedema. What is angioedema? Angioedema means swelling in your lips or your tongue, your mouth, your face, or your throat. But commonly in my practice, most patients that I've seen come down with angioedema, it's either their lips are swollen, their tongue are swollen, but in some rare cases, I have seen those that came down with throat swelling, so they were having difficulty with breathing. Okay, now when this is happening, please see your doctor. Apart from these three common side effects that I've seen in my practice, if you are taking lisinopril and you are having any reaction, please put it in the comment section so that others will learn. And if you have further questions on this topic, please put it in the comment section and I will respond to your question. I know you have learned something today. Please like, share, and comment, and I will see you in the next video.